Welcome. I am Judit Sagi from the Faculty of Finance and Accountancy of the Budapest Business School, University of Applied Sciences, and together with my colleagues, with my team, we participated in this V4 healthcare project. And this presentation, titled as "Is the Sustainable and Value-Based Healthcare System an Unrealistic Dream in Hungary?" is going to reveal some points about the status of the Hungarian healthcare system and a few steps to be taken for the future reforms. Concerning our topic, the value-based healthcare is about delivering real value for patients, improving their well-being, and enabling them to be an active member of the society. Implementing a value-based healthcare system demands extensive collaboration between all stakeholders. So, in general, a value-based healthcare system is patient-oriented and involves public and private agents as well. Well, reflecting the state of the Hungarian healthcare system, we see some challenges. Firstly, we can mention that in addition to the current care system and financing system, the hospital debt, which is approximately 150 million euros per year, it is always reproduced and in an increasing volumes. So the long-term sustainability is not ensured. This debt, hospital debt, is typically settled by the central governmental budget in each year, but the increase of the unpaid bills is typically 10 to 15% by year. And we see that the debt consolidation only improved the financial status of the hospitals in the given year, but did not resolve the managerial problems of the hospitals, nor prevented the reoccurrence of the future debts. So due to the management deficiencies in the transparent and accountable use of public funds, it is not clear how much each hospital costs and how much funding is required to operate the hospital. The problem is the separation of public and public expenditures from the private usage of the hospital equipment in Hungary. And also, as we have heard in the case of the University Hospital of Olomouc, it's quite similar is the case, because there are cases in Hungary of more expensive purchases than the average cost, the standardized cost, and also higher material usage. And also in Hungary, according to the estimates, a managerial error could be responsible for about 15–20% of the excess spendings. Although the regulation of quality validation was established, the related performance goals were not formulated. For some professors, the tariffs, the standard tariffs, are higher than the average. This is the case, for example, for obstetrics, anesthesiology, infectology, and psychiatry. And these can be considered as loss-generating medical specialties, as opposite to, for example, oncology or cardiology, with lower cost standards. It is therefore clear that the financing system should be changed after serious assessments. Also, digitalization is unbalanced because on one hand, we are working with outdated infrastructure, but on the other, we see some severe modern IT-based systems, which could lead to a future more efficient world. And finally, the healthcare system and its financing work continuously hand in hand, but in its current form, it cannot be considered sustainable. The recent changes in the world markets, including the energy prices, including the depreciation of the domestic currency in Hungary, and also the severe, approximately 200% increase of the medical wages impose severe problems to the Hungarian healthcare system. And this reflects to our next issue, the cornerstones of competitiveness. These are threefold. First, the general business and investment environment, then the human capital by second, and finally the smart growth. In advance, in case of Hungary, the human capital, which seems to be the more recent issue at the moment. The general business and investment environment reveals to the predictable and stable regulations, a competitive taxation regime, efficiency in administration, and a strengthened local supplier base, which have the potential to enhance the country's attractiveness for investments and therefore are vital to increase Hungary's global competitiveness. The human capital involves effective and supportive labor market regulations, as well as well-educated and capable workforce, which is crucial for the expansion of businesses and for building a globally competitive national economy. Related to this second one, the human capital, the Hungarian healthcare system has experienced workforce shortages for decades, and mainly due to very low wages. Actually, in Hungary, out of 10 graduated doctors, 9 left the country immediately after graduation, which led to a reform in 2021, increase of the doctors' wages by an average of 200%. In 2021-23, in the period of 2021-23. And in return, the doctors are prohibited to accept informal gratuity payments, and also they are not allowed to provide medical services in their private care, only with some very few exceptions. And the last one is the smart growth, which is about setting the cornerstones of Hungary's future success by strengthening the ecosystem and support mechanism to maximize the opportunities provided by digital transformation, innovation and R&D, increase productivity in a sustainable economy. I would like to reveal very briefly the national e-health infrastructure in Hungary, which has been introduced in 2017. The core principle of this system was to interconnect the very fragmented electronic systems in Hungary, in all of Hungary, and collect all data in a central system, and also allowing the various treatment locations to access the necessary information, including the e-profile, which is about the registry of the clients, the e-prescription of medicines pills, the e-referral system about the health status of the patients, the event catalog, which is relevant for the actual patient care, and the e-medical history, as well as the digital image forwarding, which means that even the patient can have access to the current images after downloading the necessary e-softwares. I was able also to for my personal note that I could even check my my own digital image about my kidney stones, which is, yes, it could be strange for a non-medical user. I put together some strategic recommendations put together strategic recommendations for the Hungarian healthcare system. First and foremost, to create a synergetic cooperation between state and private healthcare. The Hungarian system is hospital centralized, like in other V4 countries. And to ease this system, I think we should take more emphasis on prevention and on the specialized care, thus relieving the burden on the Hungarian hospitals. In the current system, there is a lack of strong primary care. Immediately, our doctors are sending the patients to the hospitals, and this is very costly. There is a lack of nursing and rehabilitation capacities. In order to reduce this high reliance on the hospital care, we need to build two basic pillars. First, the adaptation of the specialized care, and by second, strengthening the primary care. So establish a transparent, predictable, and stable regulatory environment could be a basis for the latest scientific knowledge and international best practices. And I think we strongly hope that we could learn from practices of Israel in this respect. Also, the advance of the digitalization of the sector, the further digitalization, and the position health as a pillar of national competitiveness as an investment priority, because this is the most important resource of the nation. And above all, prioritize the improvement of health of the population as a matter of strategic interest. And finally, some steps to be taken to initiate the reform. Without going into details, I think it could be important to have transparent data communication about the safety of patient care, patient satisfaction, and the effectiveness of care, of course, together with the protection of patient data. And also, as at the start of the presentation, I mentioned the renewal of the hospital debts, which is approximately 80 billion forints per year, to start restructuring it. At the moment, there is a reform started with the hospitals to centralize the hospitals on the level of the counties, the shires, and also the transformation and reprofiling of the hospital departments, which is also essential. So that to allocate the medical care to the right level, and to replace small separate general practitioner practices with professionally organized outpatient care communities and complex services, and reducing gratuity, which though prohibited in Hungary, it also exists in the same form. And finally, also necessary to speed up digitalization of the healthcare, as I mentioned, and for the sake of patient safety and cost reduction of hospitals, it would be important to further increase the rate of same-day surgeries. As we heard that, to decrease, for example, in case of almost the date of the surgeries from 7 to 5 days, it's also a similar case for Hungary. And the central coordination of hospital purchases, which would be important to handle the managerial mistakes. The gradual inclusion of private providers in case of simple elective services, ensuring strict quality data, and thus relieving the state capacities. And finally, it would also be beneficial to relieve the burden on patients and the public sector to introduce the institution of supplementary private insurance for the use of preventive medicines. At the moment in Hungary, we are having the public insurance, and some supplementary solutions could ease the current funding of Hungary.